Greetings, friends. Thank you for listening to the Hands of History podcast, a production of the Society of Massage Archive, the only nonprofit that is dedicated to preserving the history of massage and bodywork. Because of people like you, the Society of Massage Archives exists. History isn't just something that we store away, it's something that we can learn from. When historical knowledge is integrated to education, it deepens understanding, sharpens critical thinking, and strengthens professional identity. Thanks to our Founders Club, 50 individuals who stepped up to help build our foundation, SOMA's work is still underway. That support is helping connect the past to the present through educational outreach, bringing history into classrooms, conversations, and continuing education. But meaningful education doesn't happen by accident. It takes attention, resources, and ongoing support. We are building tools and opportunities that help practitioners and students alike understand not just what we do with our hands, but where it comes from and why it matters. As a 501c3 nonprofit, SOMA is working to ensure that massage history becomes a living part of education, not just an afterthought. If you believe that understanding our past strengthens the future of our profession, we invite you to become a recurring contributor. Whether it's $20 a month or any amount that feels right to you, every gift helps to sustain SOMA's educational mission year-round. Because history doesn't teach itself. People have to bring it forward. Learn more about becoming a recurring supporter today at societyofmassagearchives.org. Thank you. The views and opinions expressed in this podcast do not necessarily reflect those of the Society of Massage Archives. These interviews and commentaries represent the recollections of both the hosts and the guests, and as such, are subject to the occasional slight inaccuracies. The content here is for informational and educational purposes only. You should conduct your own historical research when determining the veracity of any of the statements made within.
Greetings and welcome to the Hands of History podcast, a production of the Society of Massage Archives, where we delve into the rich tapestry of massage therapy's past, explore its evolution, and share the stories that have helped shape this vital practice. Today is Monday, April 27th, 2026. I am your host, Kirby Clark Ellis, and I'm joined today with Trish Dryden. Trish is a trailblazer and catalyst for positive change with over 50 years of experience in education, research, publication, clinical practice, and community building. Trish is instrumental in the professionalization of massage therapy and the development of integrative and interprofessional research and healthcare in Canada as well as internationally. Her work is an extension of her lifelong commitment to equity and social justice and excellence in public policy and education. As a clinician, Trish specialized in working with individuals recovering from the experience of trauma and in women's health. Trish is the recipient of many local, national, and international awards. She is a frequent requested speaker and has published numerous textbooks, articles, and research in both popular and referred journals. Now, as a retiree, living with her husband Lee in the lovely village of Port Hope, Ontario, Canada, Trish is a delighted grandmother and dedicated caregiver for the elders and young children in her family. She is also giving new voice to her boundless creativity and imagination through civic engagement and creative nonfiction writing, which includes invited public readings of her work. Often funny, sometimes lyrical, and always deeply analytic, Trish looks for wisdom and astonishment in the everyday of lives lived. Greetings and welcome, Trish.
Thank you so much, Kirby, and thank you for that lovely introduction. I'm delighted, thrilled to be here.
I cannot believe that you were able to fit so much into such a short, brief bio, and I know there is so much more lurking underneath the layers of that. So thank you, and I can't wait to get into it with you.
Great, let's explore.
Let's start at the beginning. Tell me what pulled you into the world of massage therapy?
Well, when I was still a teenager, no, that's a lot of years ago. Okay, we came to visit my sister in Toronto, Canada, and I was living in British Columbia at the time. That's where I grew up in Vancouver, and I think I had some stomach pain, something. Anyway, my sister, who was always a real trailblazer herself and interested in, whatever the avant-garde thing was to do, brought in a massage therapist for me to try a massage. She thought that would help me get over, whatever jet lag I was feeling and so on and so forth. And it was a revelation to me. That was the first massage I had. And I would have been maybe about 17 years old. And I thought that was, wow, this is phenomenal. Just being touched in this way and the kindness of it, and really opened me as a person. I thought, oh, this is amazing. And then a few years later, I moved to Toronto with my then husband, and I was pregnant with my first child. And this would be my early 20s. And I got some, low back pain and this, that, and the other thing. And somebody said, well, you should go see Christine Sutherland of the Sutherland Chan School of Massage Therapy. So I did. And I had a massage while I was pregnant with my first child. And then she actually attended the birth with me and then talked me into coming to massage school. So that was, I had come to Toronto to write and to work in the creative fields, but I didn't think I was going to be a massage therapist. But I was so blown away by the experience of having massage through pregnancy. And then we brought the baby into the school. The school had only been open for a few months at the time. This was in the late 70s. And, learned baby massage and thought, yeah, yeah, I don't want to go into academia. I want to be a massage therapist. And that's what pulled me in.
That is a very layered and detailed answer. I love that, Trish. I'm going to try and pick it apart a little bit. The impetus, it sounds like, was perhaps your sister recommended it for some acute discomfort that you were experiencing, maybe related to travel, it sounds like. Did the first massage that you received then, did it help relieve the discomfort you were going through at the time?
It absolutely did. I mean, that was also the surprise. I thought, well, massage, what did I know about it? Nothing. It could have filled a thimble with what I knew about massage. And yeah, so it was an extraordinary experience and a real eye opener. It was very physically relieving. Um, and also the professionalism of the person who was working on me. This is early days of massage, but she was extreme of a certain kind of massage that came out in the 70s and 80s. But she was extraordinarily professional. And I thought, wow, this isn't at all what I expected.
All right. Let me ask you, just because I might be culturally unaware, but it sounds like you would agree that's kind of really early for such professionalism overall when people think of massage, yes?
It is because I think the history in Ontario, for example, is very, very long. We were a regulated health profession in 1917.
Oh,
So, so it went through waves of very specific professional skills and training and regulation. And then it would kind of fade away for a while. And if you look at it historically, you can really place it in relationship to the two world wars.
oh,
Because every time there was catastrophic injury, the use of massage therapy for either soldiers in the field. I mean, the massage therapists in 1917 were in France. Um, and then they would come back to Canada, and there would be waves of integration and acceptance of massage therapy in among the regulated health professions, and then waves when it was not as accepted, right? And it became, I'm not entirely sure. I haven't studied it enough to know, but I do believe that there is a real relationship between waves of acute injury and acute need and the emergence of the professionalism of massage therapy. So you see it again during the Vietnam War, for example. In the United States, you will see a wave of increased regulation in massage therapy and more utilization of massage. And I think other health professions who have been kind of both inside and outside of conventionally regulated health professions find that that's true, that there are waves of acceptance in public history. There is also the emergence of all the, ultimately, when I was growing up through massage therapy, the use of extended healthcare. So if somebody is at work and they have an extended healthcare policy, then it begins to be covered. And you see this relationship between the professionalization of massage therapy and the availability of resources for the public to access massage therapy, and increased regulation and promotion of massage therapy through the associations and the regulatory bodies.
I'm very fascinated with what you say there, kind of linking it to war times, Trish.
Mm,
Because I wrote down one thing that really struck me in your first answer was the word kindness that you
mm,
felt from that first massage experience and this sense of personhood. It made you aware of yourself as a person. And I kind of like the idea that the dichotomy between what you're describing with war times and regulation and kindness and really the humanity of the practice of massage there.
mhm.
I'm fascinated with that.
I think it's relevant, and that's a very interesting observation, Kirby. And I think that it's true. It's also, I think, as we see people become some components in culture where there is an increasing dissociation from our bodies. We become, more bodiless in our digital world. I think we are also going to see, again, that trend of people want to be touched and want to have that human kindness connection that they may be seeking if they are feeling alienated or dissociated from mainstream society or from cultural political events that are going on and so on. I think we ride that wave of, of the different isms that happen. We ride that wave as people who practice that physical connection and boundaried connection and kindness.
Another thing that I want to touch on is perhaps just a few years later, you were back in Toronto, married and going through a pregnancy. It sounds like your first pregnancy.
It was. Mhm.
And you were put in contact with Christine Sutherland. I'm wondering if there was anything about that first prenatal massage with Christine that really or how much time was between that first prenatal session with Christine to her convincing you to attend massage classes, and what really solidified that choice for you, Trish?
Well, there was about 8 or 9 months in there, typical kind of time frame, where I was getting massage from Christine. And after the baby was born, it took about another 2 or 3 months for her to convince me to come to school. So I did. But the thing that really surprised me about Christine's care in the massage therapy world and her, she was such an innovator and a pioneer, her and Grace Chan, right? Um, they were such innovators, and they were the amazing thing about getting a massage from Christine at the time, other than her phenomenal skills. I mean, she had tremendous hands and great skill, was her unbridled sense of confidence
Hmm.
and sense of ability to say to you, well, have you tried this or have you done that? She took the educational aspect of the massage therapy role because we have an hour with somebody or a half an hour or whatever the time frame is, but then there is all that suggested other things you could do, whether it was remedial exercise or using hot and cold water of various sorts and hydrotherapy of various sorts and so on. But Christine had an amazing way of grabbing from other understandings and knowledges and bringing it into her practice, offering it as saying, you might want to think about, or, she wasn't imposing anything. She was very boundaried in the way she would just suggest certain things that might be useful in your wellness and healthcare, in my wellness and healthcare, whether it was for the baby or for myself or my family. That was another big pull for me because I knew I've always been an educator and been interested in teaching and being an educator. But here was a component of clinical practice that I hadn't really thought about until I met Christine, which was you can do both. Not only teach in the schools, but teach. That is a component, an intrinsic component of the role of a massage therapist is to bring best level evidence and useful information to their clients so that they can become more empowered to take care of themselves.
The impression I'm getting is that there's also like this sense or this characteristic of exploration. You called it confidence. I'm wondering, did that really speak to you? Because it sounds like you don't shy away from exploration yourself, Trish.
No, I think Christine and Grace and I were kindred spirits from the day we met. Because I graduated from massage therapy school and became regulated and started teaching at the school immediately. But I had a background in education and undergraduate work in that and so on. So it was a natural fit for me. But I think you're right. It was a pioneering time in the late 70s, early 80s. There was an explosion of interest in massage therapy, and it felt like we were on the start of something, which
Mm.
of course was the whole development of an evidence base for practice and so on. We were at and there was so much communication between my country and your country, and uh, there was a lot of getting together and talking about these issues. It was a pretty exciting time to be in massage therapy.
I love it. I hope we get to explore that a little bit more before our time ends today. But I want to kind of ask you also about it's hard for someone like myself to imagine the start of the Sutherland Chant School because it is so ubiquitous these days. Many people know about it. I've talked to many practitioners who attended classes there. I'm wondering, were there other schools around that maybe could have gotten you as a student, Trish? Or was it really that previous work that you'd done with Christine? I'm just, what did the landscape of education and massage therapy look like at the time, I guess?
I think when I started massage therapy school, that would have been in 79, there might have been four schools in total in the province of Ontario. And I am not entirely sure about the number across Canada, but it was small number. And the other schools did not appeal
Hmm.
to me for a variety of reasons, but I think mainly that first of all, Sutherland Chan was Toronto based, so it was where I lived. I mean, locale was a big deal for me, but also it was the drive of these two women that they were so engaging and interesting, and they themselves were so interested. They saw the future. My sense was, and I don't know if this is accurate because more of it would have been sort of guesswork on my part because we didn't go to the internet to see what the school's curriculum was and so on and so forth. We sort of guessed at it, or you had to know somebody who was going there. Um, but the thing that I really got that seemed so different about what they were trying to do is that they saw the future of massage therapy, the future being integrating into other kinds of health care. So that if you wanted to work with infants or you wanted to work in a hospital setting or you wanted to, I had a notion of the importance of this being a more inclusive and accessible profession. It wasn't just for the nervous well. And so I really wanted to see that. And they had that vision right from the start, both of them. Partly with Grace's background in science, but it was also Christine's drive she thought if we could bring enough massage to the world, we could change the world. It was that time. That's what we felt we could do. Um, you can call us naive if you like, and we were. But there was something so optimistic about all of that. And they were the only school that I knew of in any way that had that in mind, had that drive in mind. And if you came to that school, you were going to be a pioneer into a new level of professionalization.
It sounds very enticing and seductive to me. I mean, yeah, you've said before what a time to be entering and be on the
Yeah.
cusp of that. I also am going to push back or challenge you a little bit, Trish. You said perhaps you were naive, but would you not look around at the profession that we live in today and not see how it totally has changed the world to bring massage to more people?
Oh, Kirby, I agree in large part with what you're saying, in that the people who can experience massage therapy can have a transformative experience, right? And more people can because it's more out there. There are more massage therapists. But in terms of, if you think about this globally, or you think about it, some of the disparities that exist, um, that disparity in some ways has gotten greater. So it depends if you see yourself in the bigger cultural context. And so you're right to push back and naive. I don't think we were naive. We just had an idea that changing the world was going to be easier than it was. um, because it's not, as you know, and you're still working at it, and bless you for doing that. But it just yeah, it's a big thing, and even after for me, after so many years in the profession, I see things that should have changed 40 years ago
Hmm.
and have not. So yes, huge changes, huge optimism. Yay, go team, go. And there are aspects of how healthcare is delivered in your country and in mine that are astonishingly not where it should be. We should be fully integrated into healthcare, and we're not. We're a long way from that. Step by step, I try and go, yay at what is happening, and celebrate the great achievements. In fact, something like this, putting together an archives and doing what you're doing is a terrific achievement in our forward movement. So again, kudos. But we have a long way to go to make massage accessible to the ordinary person.
Correct me if I'm getting the wrong impression, Trish. It sounds like there's still optimism, but perhaps tempered with more realism or experience, wisdom, maybe.
I love the latter word. Thank you for using it. I definitely think my some of my enthusiasm has been tempered, but yes, I have enormous optimism and hope for the future. I do. I'm an optimistic person, but I think given everything that's on humanity's plate, this is a complex task ahead of us.
Hopefully, some of the pieces that we start to course correct will also help all of it along, right? A
Yeah.
rising tide lifts all ships, perhaps.
That is, and I believe that does help. It does help, absolutely.
Let's slip back to the past just a little bit, Trish. Talk to
Sure.
me about massage school, a little bit more about what Sutherland Chan School was like, especially in those early days. Did you have a rotating cast of instructors? What kind of textbooks or tools were central to your learning?
Well, I mean, my class size to begin with, there were 9 in my class. Now, when you think of a typical, it varies from school to school and place to place, but in Toronto, a typical class size would not be 9 people in a massage class. There were 9. And we were people by and large who had had uh, some kind of career already, or were headed for somewhere else. And then massage grabbed them and they shifted gears. So it was and now you would see a much more, in my experience. Now, I haven't taught in massage school for a while, but say in 2010, maybe, you would have seen a very diverse, much more diverse student body, in that sense that they were socioculturally more diverse now than they were then. We were a pretty middle class, fairly well educated, probably white um, group. 7 out of 10 of us would have been female, right? So it was a more homogenous group, I would say, than it is now, which I thank heaven it's so much more diverse. But the smallness led to a very interesting thing in massage. There were consistent teachers, um, but the smallness of the class led to a level of intimacy with my colleagues in the learning process that was quite profound. And when I came to massage school, I had a 4-month-old baby. I took the baby with me to massage school because it was in the evening. There
Uh-huh.
was a day class and there was an evening class. And I could either leave the baby at home or not, depending on the availability of my husband then. And I would take the baby to class. Baby would be passed. My son Bryn would be passed from person to person in the massage school. I think his first word, and I'm not kidding about this, was he toddled up to the blackboard. He was walking. It was a 2-year program. He toddled up to the blackboard and he was standing beside the anatomy teacher and he was, scribbling with chalk on the board. And the teacher at the time was saying something about sternocleidomastoid, was looking at the attachments of the neck muscle, right? And Bryn was drawing it and muttering something about sternocleidomastoid. He has a precocious knowledge to this day about anatomy and, well into his 40s now. But yeah, pretty funny. But it was a lovely time to come to school. And again, there was that optimism. And it was also the start at Sutherland Chan. Well, the school was brand new, but there was the development of the outreach program, which through Grace and Christine's drive, they took massage therapy students and got them into placements in the community. So that was incredibly exciting because whether it was a hospital placement or a nursing home placement or one of a very exciting placement, I was at a support center for adolescent moms and babies, and we taught baby massage and taught the moms to massage each other in chair massage and so on. And they were both, especially Christine at the time, incredible advocates for taking massage out into the community. And so that's what it was like. And with 9 people in the class, there was practically nowhere we didn't go, right? Because we had so much opportunity. It wasn't a huge set of outreaches you had to create. It got more complex to do that as time went on. But it was, yeah, that's what massage was like. And we would do yoga in between uh, anatomy and physiology, and there were textbooks, but they were borrowed from other professions. Let's face it, there just wasn't, there was Tidy's massage, which was, what it was until, many of the rest of us thought, we need to start writing some textbooks because there's nothing that we have to keep borrowing from everybody else's body of knowledge. And the teachers, however, were wonderful, really good teachers. And I'm sorry I don't have the names at the tips of my fingers because, well, the tips of my brain cells, because there were some wonderful folks there, and they weren't that much older than me, so they're probably, still with us, I hope. And if they happen to be watching any of this, shout out, right? Because it was like they were terrific and also very dedicated. Coming from other professions, though,
Mm,
right? It would be a chiropractor or a naturopath or not many GPs or anybody that came later, but it took a while to develop massage therapists who could then teach, right? The people who had the anatomy and physiology knowledge were from other professions, nursing,
right.
right?
Oh gosh, I have like 4 different routes I could take next. Which I'm going to use that the end of your answer there as a jumping off place, though. Do you feel like bringing in other people to educate from other professions, was that kind of like a start or maybe an eye-opening, at least subconsciously for you, for a vision for integrative healthcare?
What an interesting observation, Kirby. And you know what? I think it probably was because the teachers were by and large from other health professions. It made me curious about their scopes of practice. And very early on, I have always believed that interprofessional education is key to our growth as a profession. We have to know what other people are doing, and they have to know what we're doing if we want to actually provide integrated, seamless care for our clients. We need to be in really good communication with other health professionals. And that was the start of it. And I think that was, again, Grace and Christine's vision for it, and certainly mine, is that we would do that. And I think having teachers, ultimately having a great mix of teachers in a school from all kinds of professions, plus let's hope that you have a lot of good massage therapy instructors who, in fact, have been in clinical practice for some time and are massage therapists. Um, it's that mix, I think, that's really important.
This also, just the way the cogs in my mind work, this is an open question. I don't mean to burden you, one person, with this question, Trish, but so an open question. I wonder if that is a unique experience to massage therapy training to bring in other professions for entry level education. I don't know if other professions in healthcare do that. And if it is unique to massage therapy, I would go out on a limb and say that that is pretty ingenious actually, to bring in other professions at entry level education. Because we had, for my entry level education, we also had a couple chiropractors. I think by the time I had left years later, they even brought in a nurse themselves. So I don't know if you can speak to that or not, Trish, or if we just want to leave that as an open question for the profession as a whole to explore. But do other professions do that? Do you have any idea?
Ooh, it's a really interesting question because I think some do, but it's often under the guise of, well, in other health professions, there are so many specialties. Let's just go to medicine, for example. So if you're going to be studying, when you go and do your neurology or you do your other specializations, you're going to work with health professionals who have that. They'll be MDs, but they will have that specialization, whether it's dermatology or whatever it is, right? Because our specializations haven't developed to that extent, right? We don't have beyond too much, uh, we don't have a lot of that yet. We have some of it. You would certainly want somebody teaching in your massage therapy for women in the childbearing years and so on. You would want somebody who had really specialized in that. But that's a later evolution in a health profession. So I think what we're talking about here is length of time in professional education and practice over 100 years of different, levels of this, that those health professions that have developed specialties, they can pull in people who have the undergraduate level, right? But then also have the specialty. I think we are just getting there.
Oh gosh, every answer that you give me takes me away from the other branches I wanted to go down. Do can you speak briefly perhaps about the difference between modality and specialization? Because sometimes in massage therapy we conflate the two. Some people say I specialize in cupping or I specialize in hot stuff. I mean, I've certainly been culpable of that. So I'm wondering if you can speak a little bit more about the difference between the two, or is there a difference?
Oh, I for sure there's a difference. And I think modalities, as long as they're within scope of practice, are modalities, period. And everybody should know them. You may choose as a practitioner not to use cupping, but if it is part of our scope of practice, then one hopes in the undergraduate level that you've learned that, right? And then been tested on it. And there's some degree of understanding of what is an acceptable entry to practice level of a skill that you need to have to be able to do that. I think the specialties issue is much broader and bigger and involves bodies of knowledge and beyond a single modality or a number of modalities. So if and massage therapy, people do that now. They're sports massage therapists, right? Because their background, they have all the modalities that we all have, but they've taken that and gone further in their body of knowledge and their clinical experience to develop a practice that addresses sports injuries at a far more sophisticated level than I would have ever been able to either assess or treat. It's just not formalized yet. We don't have, you don't then, well, maybe it is somewhere. I don't know. It could be. I'm just guessing. It probably is. Um, because we always say we think of North America as our testing ground for some of this, but of course, massage therapy practice in other parts of the world, thinking, in Russia and in Romania and other places where there are specializations. Um, it's quite different. It's quite different. We may get there. I don't know. There's pluses and minuses, but to me, that's at the postgrad level, right? It's not at the undergraduate level. At the undergraduate, you should be able to go to a massage therapist anywhere that you go, and they have the same level of skill sets from one place to another that is considered the entry level to practice standards, right? And then if they go on and specialize, even though that might not be formally recognized yet, um, that's a whole other thing. But everybody should have all the modalities, the basic stuff. If they then go on and take osteopathy, that's another several years of learning.
Correct me if I'm getting this inaccurately, at least how I'm categorizing it in my mind, Trish. Would you agree or critique that modality perhaps is more tool-based, whereas specialization is more population or condition-based?
That's accurate.
Okay,
Yeah,
all right.
yeah, absolutely.
I want to ask you back to your entry level days, Trish. Um, you were on an evening program. I was in a day program. I'm always curious what the subtle difference is that evening program may have gotten that day program didn't get, or day program didn't get that evening got. And I'm wondering if surely there were different instructors for evening versus day program. And I'm just wondering if you can riff on that a little bit.
Yeah, you know what? I haven't actually ever thought about it before. But of course, it would probably be true anyway, but our instructors who out in the evening, they would have had a clinical practice going all day, whatever they were doing. We all had our work lives or our whatever else we were doing all day and coming. So I think the category of night class was that we were all pretty exhausted and, frankly, but it was the big exciting thing we were doing for ourselves. It was also limited, right? Because if you were starting at 6, you'd be finishing at 9, right? So we would go so it's a 3-hour thing. So is that 2 classes or 1 class or whatever? And then you go at least one day on the weekend, like a Saturday or a Sunday. So I think there was a lot of intensity to the night class because even though it was a time when curriculum was mapped by hours as opposed to outcomes, um, there was a lot put into very tight time frames because you couldn't spill over into 2 3-hour classes plus a lunch hour, whatever. You just couldn't do that. And I don't even know to what extent night classes have survived.
Hmm.
I I'm not sure it was ever a doable business model um, for the schools because I think Sutherland Chance stopped with it a long time ago. I suspect there weren't that many of us that came out of night class, but it would be very interesting for folks who are listening to let you know. Did they go to a night class and how would they see it as different, or do they know if it was different and whether they still exist?
I can certainly see what you're talking about with maybe it's not as economically sound. Interesting. Uh, I'm going to resist one of the carrots you dangled for me right there, Trish, but I want to talk a bit about the outreach program. We had something similar when I went through my entry level. We called it internships. Talk to me a little bit more about that. It sounds like you were placed in an area where you were able to explore a little bit more infant massage.
Mhm. And all kinds of other things. There was a clinic for people with MS. There was a clinic for people with various degrees of physical disabilities, wheelchair, bed transfers, all kinds of things. So it there was an explosion when I went to school of interest in trying to find um, institutions and ways of attracting to come into the student clinic as well. Um, People who had conditions that we were likely to see in private practice, but very hard to get in a regular student clinic, right? In a regular student clinic that might you would see some, but it would attract people who were also there for all kinds of reasons for massage, right? Um, it was really interesting when we started to get like a post-surgical orthopedic outreach. So you would see people fairly subacute, acute actually, um, out of shoulder surgeries or knee surgeries or whatever. And that was hugely eye-opening. And I think that there is a lot of work still to keep building that because there are all kinds of I don't know what the regulations are that would, it's so state to state, as you know, as it is province to province, because that is how healthcare is delivered. Um, and insurance issues and liability issues, and so on. But the more massage therapists can be rotated through, and this was, I felt like we were really on the pioneering edge of that. Um, Places where there is very complex people with complex needs. Um, the better our training gets, right? The better our training gets.
Cool. I love it. We need that.
We do. We do.
I mean, it's one of the steps towards that next, towards that vision.
It is the step in both interprofessional education and also being engaged in clinical experiences where you might be being supervised by a nurse in a ward, along with a massage therapist, one hopes, right?
Yeah.
Um, but these are complex issues, and especially in a highly litigious world, things get messier and messier about how you get through this. But shortly after I graduated from massage therapy school, I really wanted to be in a hospital setting. So I negotiated my way into working at Sunnybrook Hospital in Toronto. Um, they had a pain clinic there that was quite interesting. This would have been in 83. And um, the two anesthetists who were running the pain clinic, they were very good at injecting trigger points, but they had more trouble than I had finding them. And so because I was trained to find it, they were trained to feel it with the end of a needle. I could feel it with my finger where they needed to go. Um, and they billed under their OHIP billing, their medical billing. They could bill for my time. So I would see 13, 14 clients a day, patients in the hospital who were in the pain clinic, the 20-minute, half-hour treatments. It was a whirlwind of experience. And I went to clinical rounds with them. I sat and talked about, I learned more in the 2 years that I was in that pain clinic than really. I look back at it with such gratitude that they took a flyer and decided that they were going to put this, weird massage therapist in their clinical setting. I saw everybody in that clinic. And that changed my way of looking at things. And I realized where we really could go if we were integrated.
How fortunate that that came shortly after your entry. I want to put a pin in this, Trish, but I am so fascinated, especially the story that you tell about the difference between finding a trigger point with the end of a needle versus a finger. I want to come back to that. But I have at least one more question about entry level education for you.
Mhm.
You tell this really delightful story about your son. And you said that he has this voracious interest or knowledge base on anatomy. I want to know, I don't want to make assumptions. Did he follow in your footsteps in a career in massage therapy or adjacent healthcare practice?
Yes.
Okay. Speak a little bit more with that, if you will, Trish. Do you think that being
Well,
surrounded by this bubble of massage education played a part in that?
I think so. And when if we get to the question towards the end about who else would you interview, I'd say interview Bryn because he is with the regulatory body for massage therapy in Ontario. Uh, in in clinic, he was never a massage therapist. He didn't become a massage therapist.
Hmm.
He did undergrad in biochem and other things, and then he went on to nursing.
Hmm.
Um, but rather than practicing community nursing, which is what he was headed for, he got an offer with the Ontario Massage Therapist Association. And then he moved on to the regulatory body for massage. So, although he's not a massage therapist, he certainly grew up with it and grew up with a deep understanding of it and pursues it in his way through it. And I think he'd be a very interesting interview when I think about it. Real visionary.
I will add him to the list for sure.
Yeah.
Outside of just being surrounded, literally in his infancy and toddlerhood, going along with you to massage school, he also had this tradition of caregiving modeled for him in you. Did you have a caregiver in your family that you were able to look at and maybe perhaps base yourself, your model yourself after?
No, I think I needed a caregiver,
Hmm.
more of a caregiver. I had a very interesting childhood and props to family, but they were not caregivers in that traditional way. And they had some complex physical ailments and so on. So I think I needed to learn about it to be that for myself. And, so many, when you interview students in massage therapy school, as you know, you get an extraordinary background of either a touch neglect, touch abuse, touch modeling, appropriate and positive modeling. There's some kind of connection there. It's not always positive, of course, for students who come into massage therapy school. Often they're coming to repair what, not often, but enough. We don't know the exact numbers, but because people will disclose or not disclose, but we do know that there's a relationship between the kind of modeling of boundaried healthcare and touch and kindness and all those things. People come to it as a calling, or they may come to it to repair things that are deeply hidden in themselves. Um, or they come to it just because they're curious. It's much more of a career now. So people will come to it because, gee, this would be a great way to make money. I think the difference when I went to school is I don't think any of us thought we'd ever make any money at it. I, there was 9 people taking a wild flyer on, gee, I wonder if I'll be able to make any kind of living at this. Um, but I think people have a different take on it now in many ways, or some people. But the reasons why people come into it, you're right. I mean, I heard all kinds of stories over the years in massage school about people who were, their mother was quadriplegic and they were coming to learn about this or that. Or a family member had passed very early and they wanted to come into massage because the massage therapist that they saw in palliative care was extraordinary with their family member. There's so many powerful stories why people are driven into massage therapy. And some are the people know already when they come into school, and some it's about after the 10th massage when they go, oh, now I get why I'm here.
Discovery process.
The discovery process, some of which is very positive, and some of it can be very disturbing for people.
Yeah, and I think we should also always be mindful in massage therapy that it's not for everyone. Uh, Students, practitioners, and even our clients. Some people are,
It
it's not
isn't.
safe to even receive safe, ethical, professional touch.
Yeah, absolutely. It's not for everyone on any side of that equation. It's not. Yeah.
Let's go ahead and jump forward now. Uh, you complete your entry level program with Sutherland Chan. You become a registered massage therapist. And in 83, you join this hospital, this pain clinic. Uh, it sounds very intensive. It sounds like you gained so much knowledge just from being in that clinical space, Trish. Before we jump into my question about trigger points, needle versus finger, is there more to be said about that experience?
Yeah, I think it changed the trajectory of my career entirely, actually. Um, because some of the people that we were seeing, many of the people we were seeing in the pain clinic, their functional pain might have been resolved, right? Or resolved in terms of medical knowledge at the time, right? But they still experienced profound pain.
Hmm.
And where was that pain coming from? So this was at the time of the work of people like Candace Pert and others who were connecting the relationship between emotion and touch and memory and touch. And I can remember in the pain clinic, I was massaging up someone's leg and there was real discomfort. And it was a resolved, seemingly resolved knee surgery that had gone a bit wrong but they had, been doing physio, doing everything, but they still were suffering from huge chronic pain. And they began to talk to me while I was just doing massage. They began to talk to me about, first of all, they said, God, I just had this weird sensation of falling off my trike when I was 3, and I banged my knee. And that was kind of the first I'd ever heard of somebody connecting a here and now touch with something that had happened to them in the past.
Hmm.
I sort of filed that one away and thought, oh, yeah, okay. And then they went on to tell me, and this was somebody who was quite a bit older than I was at the time, um, their experience in the war in World War II
Okay.
and their uh, and and some horror that they had experienced. And again, I thought, well, people tell you things when they're on the massage table. I hadn't asked about it. It wasn't part of any psychosocial history I had taken or that they had taken at the pain clinic.
Hmm.
But as it turns out over time, and we began to understand this better over time, the relationship between what we do as massage therapists, where we can quite inadvertently blunder into people's memories and feelings and whatnot and not really know what to do with them. And the relationship between that and their experience of chronic pain, for example. And this was my trajectory into going back not that long after into graduate school and really looking at the relationship between touch and memory and trauma and and there was an explosion of that going on among psychologists and social workers. And it was that time where it was just an explosion of it. And and here I was trying to find my place in that world, knowing what I did was massage therapy. And there are absolute, to my mind, very clear boundaries about what that is. Um, but here I was working in a chronic pain clinic where I would say the majority of people in that clinic had experienced profound trauma at some point. And part of the fueling of the chronicity of the pain and the suffering that they were feeling, and it was really about suffering more than pain. Um, and I was inadvertently provoking it.
Yeah.
And that was such a shock to me.
Hmm.
I thought, I don't understand what's happening here. And I went back to school to find out. And then ended up specializing in working with people who had experienced trauma. And I worked with a group of feminist psychotherapists in Toronto, and they were doing the counseling psychotherapy components of the work. And I was separate but connected. We had consent to discuss doing the body work, if you will, the massage therapy parts of the work that we were trying to very carefully help people reestablish boundaries in their bodies and so on. Um, but that came straight out of my experience in a chronic pain setting. It was just an eye opener.
Thank you for sharing that, and really helping to kind of connect the dots and lay the foundation there for that trajectory, Trish. So often, I believe it's true what you say. So often we do provoke those intense flashes of reliving trauma for our clients sometimes. And we often don't know what to do or how to deal with it. Is specialization that next step for that? And is the course that you took to specializing with trauma, this are there alternative paths to that, or do you believe that that should be the formalized path for working with trauma?
Well, I think I think we have to be prepared at the entry to practice level
Okay.
to be able to know what to do, know what this is and know what to do, and not to blunder,
Yeah.
right? And so that to me is an entry to practice level examination of the helping relationship and how, what are the boundaries? How do we communicate? How do we stay in our own lane, in our scope of practice, but at the same time know that this is in a lifetime of practice probably going to happen. So if it does, in the same way that we think, well, we have we treat people who sometimes come in with diabetes, and some of them sometime might go into diabetic shock. Do we know what to do? Right? It's the same. It's the same. And you don't need a level of specialization to be able to, you need a level of basic training that acknowledges the relationship between touch and emotion and past memory of trauma and so on, and to know not to blunder into it if you can help it, and also what to do if you do, and how to do that in a boundary safe, respectful way. And I think those things should be in everybody's toolkit. Everybody's toolkit. If you want to specialize in working with people who have experienced trauma, then that is a level of specialization. That is learning more of the body of knowledge. It's also getting supervised practice. I don't believe for 1 minute you can fly solo doing that. People do, but I wouldn't. I don't think that's a smart move because it will trigger stuff in ourselves as well. And so having a peer supervision group or having paying somebody formally to supervise that work, I think is very important as well. And there are lots of massage therapists out there now who have gone on to specialize and write very cogently and have a lot of important things to say about this. So I think you can learn it. Will it end up probably being a specialization? Maybe. I don't know. I don't know if we'll ever get there. But I hope that the self monitoring of that among health professionals is great to know that, yeah, that's not for me, man. I don't want to do that, or yeah, it could happen. And so I need to feel confident and I need to know where to go to discuss this with people safely. And then there's people who are really drawn to it and really want to work in that world. They need a level of support and knowledge and very careful clinical practice to be able to do that, in my eyes.
I'm gonna let that sit. I am finding this conversation absolutely delightful, Trish. I feel like I'm on an Easter egg hunt. There are so many, you're just opening so many pathways of doors that I'm fascinated. I'm loving everything that I'm hearing so far. I do want to ask, because we've circled it a few times in our discussion so far. You've brought up supervision. I want to
Mhm.
ask you if you could talk a little bit more about what you think the role of supervision is, should be, or could be. And because to me, my experience is that that's going to be a hard sell for most massage therapists. I
Mhm.
think most people enter this with an idea of working for themselves, being an entrepreneur, and many of them do it, to their credit. I don't know if the idea of supervision like that is a big selling point or if it's just untapped at this point. Can you talk a little bit about that, Trish?
Sure. Uh, well, there are very few health professionals in other health professions who throw their young out into the world and say, go for it, and don't have a conversation with them ever again,
Yeah.
right? So, as a self-regulating profession, which is what massage is in Ontario and in most provinces and territories in Canada, there is professional development that is required, right? So you have to keep learning. That's a good thing. I don't think anybody wants to go see their GP who has not upgraded their skill sets around pharmacology for 40 years. I really think that would be a mistake. And I think, if you put it in another health profession, you go, oh, yeah, well, of course, you want your dentist to have, the latest skills, right? And use the latest tools and know all those things. Right. Massage therapists need to think of themselves that way. I mean, are you a business? Yes, you are. You're entrepreneurial, you're a business, yeah. But are you healthcare? Yes or no? And if you are healthcare, then you have committed to something else,
Mm.
which is lifelong learning, maintaining professional standards in currency and practice. And the way to do that for most massage therapists will be through their professional association or through if they are in a regulated state or province, then they are required to do certain things, right? And which is to maintain their currency and their skill sets, but that also includes their communication skills and their all those kinds of things. So the question about supervision is a very interesting one because massage therapists in general would not see themselves in that way and don't see themselves in that way. I do. I just think that forming, even if you don't want to pay another massage therapist to supervise your clinical practice, where you have to go and say, okay, I saw, a really exceptionally complex client this week, and I think I blundered all over it, and I didn't know what to do, and I said some pretty dumb things, and blah blah blah, and to describe it and say, and here's how I was quite successful in their treatment, and so on and so forth. You present a case, and you get called on it. You get to discuss it in a supportive, confidential way.
Mm.
People don't want to pay for that, and I get that, right? Then you create a peer supervision group where you take a group of peers in your area and get together once a month for coffee or whatever. And there's four people and maybe two present cases or whatever. And you have a good old chinwag about it, keeping to highest levels of confidentiality. You can't ever reveal who you're talking about. So you change up what you have to. But then you actually have the conversation. I think we will be at the next level of clinical practice when we take that responsibility on, when we stop debating whether we're healthcare or not. We say we're healthcare and we get on with the responsibilities of that, which would include some degree of having to talk about what you do.
Yeah.
And the thing I loved working in interprofessional education was watching. I did a lot of emergency disaster preparedness stuff with in the college that I was in, and to hear very experienced physicians who had been through a simulation for emergency disaster planning say, I completely blew this. I did this, I did that, I made a mistake here, I should have done this. That level of honesty and self-reflection. And we started this conversation talking about how important self-reflection is. You know, self-reflection is very important, and it's also very easy to delude ourselves in that self-reflection process, unless somebody else is also listening or paying attention and saying, huh, why did you choose to do that? Right? And then all of a sudden you're going, huh, why did I choose to do that? Oh, I think I was bored and helping myself to whatever, right? It's that level of reflection that I hope we get to. And I think massage therapists who are encouraged to reflect on their own work, to maybe journal about it, to maybe they're not but they do go to associations, workshops, and they keep learning. That's great. That's great. I mean, people are doing a great job when they do that. If they go into practice and they just stay isolated, and they never talk about what they do or think about what they're doing, I think that's problematic. I think it opens up individuals. A, I don't know how satisfying their career can be. And B, I think it becomes, it will be harder for them to learn and grow. And the thing that is so fantastic about this profession is you change constantly. You get to learn all the time. I was never bored, right? Because you can learn so much. Part of that probably involves other people.
Yeah. I would hope so.
I sure do. I sure do. And I understand depending on where you are and what you're doing, people might be far away from that, but I hope they think about it.
I am still so captivated, Trish. A couple of things I want to ask about, though. And maybe this is just my ego, but I often see people who want their cake and they want to eat it too with this discussion on healthcare. They want to declare that massage is healthcare, but they don't want to follow through with any of the work that's involved with that, such as peer review. How does that strike you? Do you have any pearls of wisdom, perhaps, for people to consider that feel that way?
I don't know if it's a pearl of wisdom, but it's certainly, it probably isn't. It's just a fundamental belief that the amount of trust and responsibility that we have when somebody lays down on your table,
Mhm.
right, is very profound. It is not something to be taken lightly. And there is real risk of harm in what we do. So, how do you mitigate that? How do you bring all of who you are as a professional and all your skills in service to somebody else if you are not reflective about that and not willing to keep learning? For me, there's never been a debate. Are we healthcare or not? We are. And it should come with that other bag. And for people who don't think that's true, I I don't know. I wouldn't want to get on their table myself,
Right.
right?
Yeah.
Right? I'm a vulnerable human being. I want the person who is standing up, taking responsibility for what they're doing, to be a fully adult, fully aware, as much as they possibly can, skilled, kind, compassionate, boundaried human being. I think most massage therapists are all of that in a bag of chips. I really do. I really do. And we need to keep upping the ante on what that responsibility means.
Self-evolution. I also want to ask you, because often the default, when we talk about the profession as a whole, I find that the default is often solo practitioners or entrepreneurs that are working in perhaps a group setting. I, and the largest portion of my practice has been as a franchise employee. And when you lay out these examples of peer review, I find that franchise employees, we engage in it perhaps a bit more than we just have the opportunity for it more. I would assume
Mhm.
some of us do a better job of sticking to confidentiality than others. Oftentimes clients will find their way to different of it so that the lines of confidentiality can sometimes get blurred more so in a franchise engagement. But I guess my question is, are we, should people who find themselves in a franchise employment situation take more advantage of that peer review opportunity that presents itself?
Oh, for sure. I mean, I think people who, the first sort of bigger than solo practice, besides working in the hospital setting, I opened a clinical practice where I hired a whole bunch of massage therapists. We worked together and we really took advantage of that. And it was a terrific way to learn, right? Care does have to be taken with the confidentiality issue, right? It really does. And if you forget, somebody very kindly needs to say, yeah, I didn't hear that, and let's not use that name.
Yeah.
Just it's simple, really. It's simple. And people make mistakes, but then they're big enough and strong enough and smart enough to not repeat it and all that stuff. But I think it's tremendous when you have the opportunity to share information. I can remember sort of walking into the linen closet with one of my colleagues in the business that I ran, and I said, "I'm at a complete loss. Can you give me a minute here? Because I don't know what to do about X and so on and so forth." And they were terrific. It was the minute in my day that kind of turned a more complicated situation around and allowed me to go, oh, okay. Yeah, that sounds good. Yeah, I'll do that. And it's great. And it can be just straight up the sharing of very, very pragmatic techniques, both physical techniques, communication techniques, but it doesn't have to be Ike Psyche at all. It can absolutely be like I have been working at this muscle for about a month now and nothing's happening, right? And somebody says, well, you know what? I would do the reciprocal leg because that's going to give you the release you want. You're not going to get it by working directly on a sore thing. That's my experience, right? Or have you seen the article in X and So paper? They've been looking at that and they think it's blah, blah, blah. Wow, cool. That can happen in these franchise settings that I think is a huge benefit to massage therapists.
Awesome. Thank you uh, for that insight and encouragement as well. I really love this idea of a group of therapists who just gather together and, it sounds social, but it's also professional, this peer review. I'm I'm fascinated, Trish.
Yeah. It's something I certainly did for most of my clinical career.
Right. Sounds like
Yeah.
you also highly recommend it.
Yeah, I do. Yeah, I do. Yeah, it was fun. And these are people I care for to this day.
The Society of Massage Archives invites you to join us for a virtual book club and discussion circle, a monthly 90-minute virtual deep dive into Dr. Patricia Benjamin's book, The Emergence of the Massage Therapy Profession in North America, A History in Archetypes. This isn't your typical book club. It's a conversation where we'll read the emergence chapter by chapter, reflect on the stories, struggles, and triumphs that shaped our profession, and explore how the past informs our current and future circumstances. Discussion circles are moderated by SOMA's Executive Board of Directors, with special guest hosts and Q&A sessions with the author, Dr. Benjamin. Registrants will receive access to the ebook format courtesy of Sutherland Chan School of Massage in Toronto, Ontario, Canada. Virtual meetings will be held on the second Monday of each month at 6:30 p.m. Eastern, 5:30 p.m. Central, 4:30 p.m. Mountain, and 3:30 p.m. Pacific. Visit our social media on Facebook and Instagram, or our website at societyofmassagearchives.org to learn more and get registered today. We'll see you soon.
Let me guide us back. Let's talk a bit about the pain clinic at the hospital, about my question, helping, and maybe that's not the right word, but helping really narrow down and finding these precise trigger points that
Mhm.
perhaps the nurses you were working with weren't as skilled or refined with that. To me, that sounds like a really interesting research question. Do you know if the people who received your help with finding those trigger points more precisely had better clinical outcomes, Trish?
I don't, because we weren't tracing our, we were, outcomes were being traced, but they were very broad, right? They had to do with pain levels and so on and so forth. And I don't remember enough of the specifics to know whether the the variables that were entered into Like, did they get massage? Did they get this and that? I don't think we were specific enough. It was before the kind of much more carefully constructed evidence-based research was being done. But I would say, and these were physicians I was working with who it's just that they said it themselves. They could tell precisely where to inject into a trigger point because their ability to sense the end feel of the tissue through the mechanism of a needle was great. I wouldn't have had a clue. I mean, I just stick my finger with a needle when I'm trying to sew up a button. I mean, what do I know about it? But because I could work with my fingers to feel that end feel, and not even end feel, because we're not talking bony end feel here. We're talking about the component where when you press into a tissue and you just feel it press back,
Yeah.
right? You know that sensation. And it's something that massage therapists pride themselves on their skill to detect. And in fact, we're darn skippy at it. And having us help with that, or I even showed a physician how to do that, right? One of the guys I was working with, because he knew exactly what I was talking about. It's just he didn't put his hands on for long enough on a person to be able to feel that. But it took him all of about 3 seconds with his training to be able to get it, right? Oh, he'd say, oh yeah, that's what you're feeling for. I said, yeah. And the referral, he understood the referral mechanisms because he'd read the trigger point work, he got it. But it was just slowing down enough, and it wasn't his modality to actually put his fingers on for long enough to be able to feel that. And that's something we do exceptionally well. And yeah, we could put it at service into with other health professionals.
I'm also wondering, Trish, if the role of repetition also, because we use our fingers every day. The physicians you were working with use the needle, I'm assuming, maybe not every day, but a good,
Yeah.
that's what they're using. The role of repetition in what we do. Because also, when I take continuing education classes, it's a weekend, and then if I can't fit it into my regular day with clients, that knowledge just completely gone if I don't keep retracing those steps that I learned in that class, right?
Right. And I think that's exactly right. It is repetition, like any skill. It is clarity and repetition and learning the skill very exactly, and then just doing it over and over and over till you do it, till you get it done. Right?
Right.
Absolutely.
I'm going to be vulnerable here because I'm not a researcher. I have very minimal understanding of research and the process and all of that too. I'm working on it, but does that sound like a good research question? The difference between the clinical outcomes of those who received your massage touch versus those who didn't in that pain clinic, Trish?
Yeah, that opens up the whole question, Kirby, of do you compare one modality to another? That's a kind of research, right? Where you look at one way of doing things versus another, and therefore, if this other thing, you look A versus B, and if B turns out to be have better clinical outcomes, then B must be good. I'm not sure that's the kind of research we should be focusing on, to be really honest, because it sort of pits us in competition with certain things. And I'm not sure that's where we're going. If anything, is that plus that useful? Um, I think we need to really focus on the outcome. Is what we say we're doing actually happening?
Mm.
Right? So very outcomes-based research and very pragmatic research, which will tell us something that we can use clinically, because we don't have enough money, even though I totally believe that we do need to be doing mechanism and we do need to be compare and contrast. We need to be doing the whole range of kinds of research. And that would be great. And if we had bazillions of dollars, we'd be doing it. But usually there's only a little bit of research money. So I think where we can to really focus in on very, very specific, if we do this, does that happen kind of research. Because it didn't have any evidence base or not much, it borrowed it from physio or whatever. We used to just wholesale make things up,
Yeah.
right? We just make it up,
Sometimes we
right?
still do, Trish.
I was just being kind about that, Kirby, and very generous, but you bet we still make it up. And it just is somebody who's pretty pragmatic, that would be me, but also optimistic. Um, I just don't think we need to be doing that. If we say we do something, let's figure out if that's what we do. And that sometimes can be a very rigorous kind of study, but often it might be a series of case studies, right? Somebody is working in a particular patient population and a particular condition, and they're doing something similar over time, and then they're tracking the outcomes, very pragmatic outcomes, like pain levels and sleep and mood, and the range of motion. And then I think we develop some body of knowledge from that that is more useful for the rank and file than if we try and do a very, we need this. I'm not saying we don't need it. We do. It's just there isn't enough money or time in the day to get it all done. So we should think very carefully about what we fund. What's going to have, personally, what's going to have the biggest outcome for the client? If we learn this, if we find this out, what will make the biggest difference to the people we serve? That's one form. The other is in education, research, and so on. If we teach it this way, or if we teach these things, what helps our practitioners be the best they can be at what they do? The most ethical, the most aware, the most, those two forms of research make me very happy. The other stuff, I just wish we had, but we don't.
Maybe one day.
I hope so.
Let's get back to it. Where did you go after that experience with the pain clinic in the hospital in 83 or around that time?
I opened a business, a clinical practice with two or three other massage therapists. I rented a space that was in the heart of, it was called Angst Alley because it was where all the psychiatrists were in Toronto along St. Clair Avenue. And I thought, these are the people I want to talk to. I want them to refer to me and to refer to us. And these were folks I knew in a variety of ways. Either they were former students of mine, or they were, the school I worked in, or I had met them professionally. And we ran that clinic for about 5 years. And then two of them who were working with me bought the clinic from me because then I was starting to really focus on research and moved into that next piece of my career and moved into the public education system, into a college, and was very interested in exploring that because I did explored private vocational school practice, which was, Sutherland Jen is a wonderful school and a very ethical, good school. But I knew I was not going to be able to attract research dollars to a private vocational school. It was unlikely
Mm.
because research money comes from governments and so on and so forth, and they like to deal with other government-run organizations that have research ethics boards and so on. So that's why I moved into the public healthcare system. And also, again, this whole notion of inclusion, right? I mean, it was a bigger variety of students with wider socioeconomic backgrounds, and so that was great. But the business part, it was a very successful business model, and the clinic did very well. And it is not in existence now, but I think it ran for another 5 or 10 years. And it didn't get bigger than 4 or 5. It wasn't like some of these very big franchise models and so on. I just wasn't interested in that personally. But I know people who've done very well with that and been very good. But we were we marketed what we were doing right in the heart of Angst Alley there. And then people, psychiatrists heard about us and MDs in the area. There were a lot of physicians in the area, and they would refer into us. And we wrote information we kept in good contact with these folks. If they referred, we always wrote them back and we thanked them and we said what we were doing and so on and so forth. I mean, and we used the kinds of forms that they would need if we were going to communicate about a client. I mean, we had information release stuff. We took good histories. So we it was quite medical model in that sense, but it also allowed us for ease of consultation and discussion. And also, unlike some, we did not claim to do things that we know perfectly well are made up,
Yeah.
right? We didn't say we were all that and 3 bags of chips. We just didn't say that. We said, this is what the evidence shows us so far. We think we can help in this way. We took a very conservative approach to saying what we do and what we could prove we could do, rather than, yeah, we cure cancer.
There's a huge difference. I'm sure that your approach helped build trust also with those other practitioners over.
I believe it did and warranted trust because we were being that careful.
I also love the strategy of choosing Angst Alley. I love the name of that also, by the way. Correct me if I've got this wrong real quick, Trish, but it sounds like working in that hospital, having that experience where you unintentionally sparked a traumatic response from a client or maybe several, kind of led you on this path towards psychology. Did you have any interest in that aspect of how massage interplays with trauma before then?
I did. I did. I've always been very interested in psychology, my own and probably everybody else's. But and I have done a fair bit of the therapeutic process myself. I've been the vulnerable person on the couch, and and learned a lot that way about myself. And so I think that was also very useful. But yeah, for many, many both personal and professional reasons, I think I see in hindsight that my career had a trajectory and had a pattern to it that I was following, even if I didn't early on completely understand what that process was. I certainly, looking back at it, I can see it very clearly that I put myself in those situations and with continuing education and everything else because I was drawn like a moth to the flame. I was very interested in this and still am. I find the inner world, inner life very fascinating. And I think that massage is an intrinsically creative doorway into an inner life.
Let me ask you, what is the number one thing you learned from that side of the profession, being a business owner, clinic operator, Trish?
Number one business thing. Oh, the fundamental importance of having your ducks lined up, like understanding how a business runs is very important. So the ethics and the pragmatic components of that. And then the relationship with the people you work with. It has to be built on trust and respect. And so often I hear historically, have heard from massage therapists who felt that they were very exploited or treated badly. You know, I was a business owner. I did not want to be a bad business owner. I wanted to be an ethical and good business owner, not only for the clients I served, but for the people I worked with. And I think that that is incredibly important. And there are ways of doing that. And there are ways where people do it, don't do it, or do it very badly.
For sure. Which came first, Trish? Being an educator in massage therapy or working with a regulatory agency?
I was an educator first.
Do you want to speak about that pathway?
Yeah, I was teaching at Sutherland Chan and I was in clinical practice. I was working at the hospital. I was working in my own practice. I was working for a period of time at Sutherland Chan's clinic, I think. Um, you cobble it together at first. You work in a variety of places so that you can make a living, right? And most massage therapists work multiple places. And so we know that from looking at where are people working. But then something happened in Ontario that was a total opportunity for massage therapists in the mid 80s, when most of the people watching probably weren't even born. But anyway, in the mid 80s, there was a health professions regulation review in Ontario, which meant all the regulated health professions. And we were regulated, but we were regulated in this arcane act called the Drugless Practitioners Act. And then there were physicians and nurses and everything else. Anyway, the government looking to make savings, that was part of the motivation, also making it easier for patients to find out who they should be seeing, although I don't think that was actually the number one motivator. Studied a number of models globally, particularly in Sweden and in other countries in Europe, which had a model where all the health professions are regulated in the same way under the same act. But then they have profession-specific components, like their scope of practice becomes profession, what a physio does versus what a massage therapist does versus what a chiropractor does. These are all very specific acts, and their educational requirements, their entry to practice requirements, and so on are very specific components. But if they're a health professional, they have to be able to do this, whether you're a GP or whether you're a chiropractor or whether you're a massage therapist, you have to be able to do those things, right? That is part of what you deliver as a healthcare professional. So I thought, well, that's a visionary tool. And we had to fight to stay in the health professions. They wanted to just get rid of us. They thought massage therapists, what do they know?
Right.
They ought to go, right? Who needs to be? And I knew if we didn't fight for this, if we didn't fight to be included, we would have been left in the dust.
Yeah.
It would have been over for us. We would have been what secondary insurance companies were going to touch us with a barge pole. It would have been a mess. What regulation? Please take a 100-hour weekend course and call yourself a massage therapist. Great. That's what would have happened. And it wasn't just me, it was a whole bunch of us in the association and so on. And so I was asked by the then regulatory body for massage, who were saying, we have to put these, we have to submit these proposals and we have to show our evidence for practice. And I thought, oh, good luck. And we have to show this, that, and the other thing, and that we have standards of practice and we have ethics and. And I said, beam me up, Scotty, I want to play. So, a whole group of us got down to it. And because my own background was in writing and my undergraduate work was in literature and research and everything else, I had I had some stuff I could base this on. I understood how to research this stuff and how to find it. And there were others I was working with at the time. And so we submitted all the things that we needed to submit. And it came down to all the proposals were in all 30 regulated health professions or whatever it was. That I can't even remember the number at the time, but it was something like that, 20, 25, 30, I don't know. And we thought, oh, we're dead in the water. We are so dead in the water. We don't have a scope. Our scope looks but we created a nice one. We based it on the physiotherapists, of course, and changed it up a bit because, they're accepted. Surely we would be. And and we had to figure out risk of harm. And at the time, massage therapists weren't being sued, and so there wasn't the kind of, you know, chiropractic had no problem finding risk of harm because they had, arm's length litigation against them. We didn't because, somebody went home and felt terrible the next day. They didn't think, oh, that was the massage therapist. They thought, oh, I must have the flu. Anyway, but we figured it out and we put together, telling the truth, what we could do, and we made our case. And at the end of the day, we also hired the toughest lawyer we could find
Mm.
for the money we had, he had been a litigator with the College of Physicians and Surgeons. And we convinced him that he needed to play and he needed not to overbill us and kill us. And we were going to pay for his time and he was going to help us translate what we were trying to say into perfectly understandable legalese. And he did. He did just that. And he came and argued our case with us. I think we would have put up a good case, and I think we would have lost.
Mm.
I think if we hadn't hired the smartest, toughest lawyer we could hire, um, we would have missed the way in which the information had to be delivered because we weren't legally trained and we were so kind and so nice, We wouldn't have, yeah, no, we would have been, get rid of those guys. But Richard Schechter, shout out. Um, just, I think he really helped us at the end. I mean, it was based on everything we told him. I mean, he didn't know what we did, but we figured if we could convince him, he could convince them.
Right.
And that's what happened. And we got included into the new Regulated Health Professions Act, which put a great deal of onus on us to keep producing the kind of documentation and things so that how we knew we were living up to our standards of practice, how we knew our testing was evidence-based, et cetera. It just opened a whole, Pandora's box. But to this day, I think it is the single thing I'm most proud of in part of the leadership role that I took on in the profession, because and the whole group of people that we work so tightly with, I think that was incredibly important. And so we became part of the Act in 1991 and moved out of the arcane Drugless Practitioners Act, whereas naturopaths languished in the Drugless Practitioners Act for years.
Mm.
And then they figured it out. It figured out what they needed to do to translate their extremely important body of knowledge and their level of risk of harm and everything else to something that could be regulated. And should be, not could be, all of it could be, but should be regulated. It had to be proven that it was in the public interest to do this.
Yeah.
Right? Otherwise, who cares? I mean, why would a government get involved? And that solidified a whole bunch of stuff for us in a way that then allowed insurance companies to interface with us. It allowed us access to corridors we were never allowed in before, because we became, part of the club.
Give me a reminder, Trish. Is that just provincial or is that nationwide?
It is provincial, but most provinces in Canada have followed a similar trajectory, not all.
All right. Thank you. And so then talk to me, I guess, a little bit about your experience as an educator in massage. And maybe this is a good point to point out and a reminder for those who are not Canadian listening to this, the difference between college regulator, college education.
Right. College just means the regulatory body, the College of Massage Therapists of Ontario, or the CMTO. That is the regulatory body. And it's the same as the College of Physicians and Surgeons, the colleges of nursing, the College of Dentistry, and so on. These are not educators, these are regulators in self-regulating professions. And they're essentially blessed by the government, and they have to maintain a certain number of individuals and certain committees and certain ways of doing things. And massage therapists pay fees to the regulatory body, who then regulates the profession and ensures that they are meeting the standards right? And then there's the association and the college's interest is in the public. It's public protection. Whereas the association, they are interested in preserving and promoting the needs of the massage therapist, of the professional. So most massage therapists are members of both. You have to be, if you're going to practice being an RMT in Ontario, you have to be a member of the College of Massage Therapists. They hold the exams, they do all of that. You can choose to be a member of the association, and fortunately for us, most massage therapists do because they have a very, very important and very different path. And then colleges are like colleges and universities. They can, in Ontario, there are, I don't know how many now, but public schools or colleges or universities that have massage therapy programs. And you take it as a diploma. It's not a university degree, but you get a 3-year diploma. Or you can be in a private vocational school, which many have really brilliant curriculums as well. And they have varying lengths of time because, of course, it's outcome based now. You have to be able to do a certain thing and then be able to take those exams at the end and pass those exams to become a massage therapist. So there's a common hoop that public educational institutions and private educational institutions, the common ground is they have exams at the regulatory body that they have to take. So that's a common ground. So I moved from a private vocational school, which I think most of the models probably in the US are private, but there are some public ones as well, I know. And because that's when I wanted to start trying to fix this problem of convincing people who control curriculum that they needed to teach research literacy at an entry to practice level. You have to be able to at least read this stuff and know what it means, right? That seems kind of basic. Nobody is expecting somebody in entry to practice to then go, well, you know, what I want to do is be a PhD researcher in a university. Yeah, some guys will do that, but mostly you need to be able to read something in a magazine, whether it is a peer-reviewed magazine or professional journal, and go, yeah, okay, yeah, that's rigorous. That looks good. Yeah, that may cause me to think differently about my practice, as opposed to, yeah, I have no idea what they're saying, and I don't know if this is any good or not. That skill set is not rocket scientist stuff. It is straightforward. You learn how to tell the difference between different kinds of research, good research, not so good research, and you make your best available decisions. And it's not always about massage. If I was treating somebody with MS, I'd be going into the MS literature, right? But I think we've reached that point, at least in some jurisdictions, where that is considered an entry to practice necessity, right?
I hope so.
Yeah, well, it is in Ontario. I mean, they're measured on research literacy. I mean, you have to be able to read basic research,
Good.
and which is great, right? And then from that comes people who then go back to school, like Amanda Basquill and Donelda and others who have gone back to school. And I'm talking about now Canadian massage therapists who have gone on to do graduate degrees also in research, so that they're able to produce the research, right? And I think that's great. And not all massage therapists are going to want to do that or be part of that, but minimally it'd be nice if most massage therapists, not even nice, I think it's necessary that most massage therapists now need to be able to critically read, right? You would think that no matter what. I mean, right? You've got the internet now. There's all kinds of things being claimed on the internet, and teaching basic literacy so you can tell the difference between an AI generated piece of fact and a other kind of fact, and then there's that other kind of fact that we're all very nervous about. Um, uh, Yeah, I think those skills are not as daunting as sometimes massage therapists think they'll be. They're not. They're the same critical skills you took to any kind of learning about anatomy, physiology, pathology, same set of skills, just applied to a slightly different subject area. Same set of skills.
All right. Again, I'm taking baby steps right now, so I'm going to trust and have faith that I will find that to be true at some point, Trish. I'm struggling with it right now, but I'm getting better.
Yeah, well, good for you for tackling it because I think it will open a world to you, a world,
Yeah.
right? That is like, wow, there's all that stuff out there I can read.
Yeah,
Yeah.
absolutely. Yeah, and I think it only does better to benefit myself as a practitioner, but also the profession as a whole, Trish. When did you first get an inkling or the bite for research? And talk to me a little bit more about what that path has looked like and share some stories in there if you can sprinkle some in, Trish.
Well, and I think that experience in the hospital setting where I was seeing people who were telling me things that I didn't ask them to tell me, and I had no idea why they were telling them to me while I was working on them. No idea, no clue. Um, but I was very much a woman of my time, a person of my time, where there was this explosion of information about trauma and so on and so forth. And I thought, I think it's related. And so I had an undergraduate degree, so I had done some, research in university and so on before, but related to my own areas of interest. And I thought I was going to be a Chaucer scholar, but apparently not. And so then after I became a massage therapist, I could apply some of those skills. And I must admit, some of the stuff I read in massage therapy school, even I knew that it was bunk. And I didn't need big scientific research literacy to know, like, say what? Right? So I thought, well, if I really want to tackle this, I should really go back to school. And I did my master's at U of T and and got really bitten by the research bug then and took a lot of courses in it and including, and this is by way of encouragement. I've never thought I was a mathematical genius, but I did take statistics.
Oh,
And eventually it made sense to me. I think I did take it twice, but eventually it did. And the really great news I'm here to tell you is that there are programs that, well, you plug data into and it does it for you. But apparently, if you want to be a researcher, you have to actually know how that works.
shoot.
Fair enough. But you don't have to know how exactly how it works if you're going to read research. You have to understand it enough to go, oh, they used a proper statistical pathway to look at that data. You don't have to then reproduce that pathway.
Okay.
That's what researchers do. And they go to school for a long time to learn how to do that. It's another thing. And if you love math, go do it. Um, and it's very interesting. So that I got the bug, but really it was also at the same time that we were going through the health professions legislation review, and we had no evidence for practice of any real worth. And I thought, we can't keep playing this game for too long before they're going to wake up and say, so why are we regulating these people? They don't do anything and there's no risk of harm,
Yeah.
right? There's no evidence that they do anything and there's no evidence that they have any risk of harm. They haven't killed anybody yet. And so I thought I wasn't motivated to find that out, but I was motivated to help us understand what we do so we could do it better, so we can serve the people we serve better. And I believe that to this day.
In reviewing your CV, Trish, there is a long list of research that you have been involved in and author of. And then even like there's one portion where you had to just choose select portions. I'm I don't even know how to formulate a question on all of this, Trish. Maybe what has surprised you most in terms of research that you've been directly involved in some way? Anything that just really knocked your socks off that maybe you weren't expecting?
I think the greatest pleasure for me in all of this is the people I might have had a hand in mentoring who have gone on to uh, shine so brightly in this world. I think I dabbled. I mean, you look at the big long list and you go, whoa, and I'm going, well, it was a something, you know. But then when I think about those who have come after me and where they have taken the research for us, it's like, oh, such pleasure. So the biggest aha was I got this group of colleagues, both people I mentored, but people who mentored me, and they were in different professions. There was pharmacists like Heather Boone at U of T and Maria Virhoff in complementary and alternative medicine, and she has a huge background in research. I forget exactly what her PhD's in when she was at University of Alberta. And Sunita Vora, who is a pediatrician who welcomed me. And I would say, I think what we're looking at is, and I would mutter whatever I could mutter about from what I knew. And and they would go, aha, ah, and help me translate that into finding another way. And that's so similar to what we do, or right, isn't that interesting? And so when we worked on kids and cancer and research, we created an educational intervention for an evidence-based educational intervention. So touching on all the things that are so important to me, um, for parents of kids with cancer who don't know what to do when things are very serious and their child's life is they're fighting for every minute, and they have nothing they can do. The kids, their child might be hooked up to various machines and things that they need to do, but they could touch their child, but could they safely touch their child?
Mm.
And this helped reassure them that indeed there was something they could do and be part of the healing for their child. And I thought, well, now research like that just doesn't get any better to me. That is like hits all the things that I care so deeply about. And I got to work with some superb professionals who knew a great deal more about how to do research and what to do with it than I would ever know. But I knew how to put hands on, and I knew what comfort it might bring as much for the parent, which was the outcome of that research, is this has as big an impact, if not bigger, on the parent feeling okay and feeling better about what was going on and feeling more empowered and more connected to their child. And I thought, oh, worth the price of admission, that. Um, yeah. So those are the kinds of highlights for me is where this is going, and how I don't think I'm not interested as a massage therapist in doing everything. I'm interested in what we can do as part of the healing community. And that led ultimately, because I was working with colleagues across all kinds of professions, into my interest in interprofessional education, because I think that if you sit a group of massage therapists and physiotherapists and chiropractic students and naturopaths, and you put them all together, and GPs, you put them all together in a class in year one anatomy, I'm telling you, the bones are the same, whatever profession you're in, right? So you put them in the same class and make them interact.
Yeah.
At the end of the day, they don't graduate umpteen years later, a few years for us, longer for them, whatever. But you don't leave not knowing what the other does. And then you solidify it by doing TOSCIs instead of OSCEs, the oral practical exam. A TOSCI is a team-based oral practical exam. So you put a GP and a physio and a massage therapist and an ophthalmologist and whatever. You put them all together in a room, put a fake patient in there, and they have to solve the problem collectively.
Mm.
That is transformation. That's radical transformation. Then everybody is in service And the neurologist might say, I can't help here. Maybe you can, right? Or the massage therapist might say, whoa, I don't know what to do here. You're going to do this part and you're going to do this part. Maybe I could do something that would be soothing for them by doing X and so, right? Then we're in a whole other world.
Do those happen, Trish?
Mhm.
Toskies happen?
They did for a while at University of Alberta, I think, and I'm not sure where else, whether that's still being done at U of T or I think, but to me, it's the future of healthcare, where you try and put healthcare students of any discipline together at certain points and separate at other points because they're profession specific stuff. And then you bring them together and ask them, what is in the best interests of the person, of the family? And you have a social worker in there as well, right? What is in the best interest? I mean, there's the number of times I heard from massage therapists, if I could just massage this person, they're going to feel so much better. And I was thinking in my mind, if you could just give them $10,000 greater income, their problems would be solved.
Yeah.
They wouldn't need you. They wouldn't be having a complete fractured fry down if they actually had equitable income and care and so on. So this is where we break down those boundaries. And that's the vision that I see longer term.
I love it. Thank you for opening my eyes to a new possible future, Trish. I love that. We are at our original stop time. If
Okay.
it's all right with you, I would like to try and squeeze in maybe some rapid fire history specific questions and
Sure.
go into our closing thoughts, Trish. First of all, I want to ask, are you involved in collecting or preserving massage history in any sort of ways? Books, stories, equipments, photographs, etc.
I certainly have all the stuff I've had over the years, right? That related to my own practice or books I worked on or articles I worked on. That's all assembled. I have that. Um, I've not been really great with photographs and things like that. I think Grace Chan is hunting up some because we've got the 50th anniversary of Sutherland Chan coming up.
Ooh,
And considering my now husband was in the first class and I was in the second class, yeah, we can't wait. We hope that members of our classes get to find out about this and we reconnect with them. That would be lovely.
yeah. Okay.
Yeah.
What do you see as the value or the challenge of keeping massage history alive?
I think you nailed this issue right at the beginning when you said reflection, that we have an obligation as professionals to reflect, and it includes reflecting on our own history and preserving it because it will disappear. Some of us, many of us, I've lost many colleagues over the years to early deaths or timely death. I have colleagues that are in their 90s, right? So, you know, we're a we're a disappearing group too. So preserving this, and again, Kirby, the work that you're doing to do this will have huge resonance and impact in the future. And I hope everybody sends you whatever materials they have or connections to whatever materials they have, and you interview people because a lot of this is an oral history, right? It's not been written down. We're not the greatest at writing books about our own history.
Yeah,
Hopefully you will be inspired to do so because there is and there's some good stuff out there actually. But yeah, we need to capture it before no one can remember.
for sure. Do you have any thoughts on why today's students and practitioners should care about the history of massage?
They're standing on the shoulders of giants, whether they know it or not, and people who took huge risks to bring us to here. And they have future generations that will stand on their shoulders because I truly believe it's what you pay forward in this profession to those who are coming up that makes the difference. But to do that, you have to know what's come from behind because otherwise we keep repeating the same mistakes. And I see it in certain things that happen, and I go, whoa, we were debating that 30 years ago. Why are we still debating that? But then again, life is like that, right? We see that politically, we see that more than that, I probably should not comment, but we see that in so many ways that true knowledge of history helps us to forge a future we want. Otherwise, we get the future we get.
Yeah. And maybe not a future, maybe oblivion, heaven forbid.
Maybe not what we want at all. The
Um,
harder we are to get rid of, the more solid and grounded we are
mm,
in what we know about ourselves, in what we are doing to professionalize and to stand and to uphold standards, the harder we are to eradicate. Otherwise, we will, well, I don't think so. I think we are fairly hard to eradicate, actually. I think we are.
in some way or another, right?
Mhm.
Is there any way that an understanding or an appreciation for massage history has shaped your own practice, your philosophy on care and touch, or changed the way that you've shown up as a therapist?
Absolutely. All of it. I came from a time when some of the institutions that were graduating students were pretty loosey-goosey and didn't, I don't know, there just wasn't enough solid grounding. And and I was quite appalled by it. And it was not where I went to school, and it was not my experience, but directly, but indirectly, I saw it and thought, I don't want to be part of a profession that does not reflect on its own history and on what it can do to make things better. I think a very changing and telling factor for me was when I finally learned. I mean, I think I was in practice for a while before I found this out, and the regulatory body for massage in Ontario asked me to make a promo video for them. And they had me dressed up as a World War One nurse. And you might go, why? Because, and I had not really understood this, that massage therapy is not in Ontario, was not come lately to the game. We had been regulated as a regulated health profession since 1917. And the reason being is that in when the Great War, World War One, was being fought, they could not produce either nurses or physiotherapists fast enough to work with the soldiers who were being injured at the front and in the fighting. They could not produce them fast enough because it was like a 2-year training or whatever. So they took people who had a calling for this, or maybe were nurses but didn't want to be nursing, wanted to do something. And they created a 1-year program in massage therapy in 1917 and then sent those graduates in nursing uniforms to France,
Hmm.
where they worked directly. Once somebody had been stabilized in the field hospitals, rehab started immediately. Massage was included in the rehab order because of certain very forward-looking physicians who wrote textbooks that we all read. They knew that if you could get hands-on and get things moving and get the tissues relaxed and so on, you were going to transfer out of the field hospital to more care, and then unfortunately back to the front. It was a real revolving door. The faster you could do it, the more soldiers you had, um, and we were part of that, both in the scary aspects of that, but also we were totally treated as compatriots in the service of humanity. And I think knowing that that had been going on all that time, and then through the whole sort of, are we body rub? Are we, what are we? All the weirdness that happened in the 70s and so on. You just go, wait a minute. When I found this out, I thought, we've been health professionals for years. And of course, as you know, for generations before that in European countries and so on. We were very much an integrated part of healthcare at various points. And um, or the skills we used, whether they were effleurage or petrissage or whatever, had been incorporated by other health professions as part of the tools one uses to serve people who are suffering and who need help. And the learning of that, of how deep that history was, even just in Ontario. And I had no clue. And that was never taught in school.
Right.
I had no clue.
Yeah.
And I sort of went, wow, we need to keep looking at this because this is how we go forward.
Yeah. Absolutely. Thank you for that, Trish. Because yeah, stories like that need to be shared and told and appreciated and celebrated. Let's go into our final five for you, Trish, our closing thoughts. When you take a moment to look back on your entire career, what are you most proud of? Or another way to think of it, what do you hope you will be remembered for?
Uh, that I held the fort and that I helped in whatever small ways inspire the profession to move forward. That's my big part of my professional career. Directly, I am in awe of the clients who have taught me everything,
They're our best teachers.
our best teachers. And I hope I have passed that on through all the different ways in which I have tried to do that, and certainly even with my own children
All right.
and now grandchildren.
Absolutely, and congratulations on that. If you could record one historical figure's account of massage, someone who's no longer with us and deceased, who would you choose and tell me briefly about why?
I would like to talk to one of those RMTs. I don't know if they were called that, massage therapists, I suppose, um, who were there in 1917.
Mm.
I would actually like to sit and have a conversation.
Yeah.
What was that like? Did you have any idea what was coming?
And what do you think of it now?
Yeah, and what do you think of it now? And then go, you mean you're still wondering if your health care?
I thought we answered that for you
I
already.
thought we answered that question. What is it even on the table for?
I love it. All right. The flip side of that question, who would you like to hear on this podcast next? You already mentioned your son. Is there anyone else you would like to see interviewed or think has an important story to tell?
Yeah. Have you interviewed Pam Fitch?
Yes, she was a lovely interview.
Yeah. And Pam Hodgson?
No,
She's
and
in Nova Scotia, or she's in Newfoundland, I should say. Pam Hodgson would be great. Yeah, it would be lovely to find a massage therapist, and I will give this some thought and send you a name.
sure.
But I would have to get their permission first, of course. Um, who has been in the practice, is still in the practice for like 50 plus, 60 plus years, because I'm no longer practicing, right? But I think there are a few that are, and it would be wonderful to hear their stories as clinicians
All right.
for all that time, right? It'd
I
be amazing. Amazing.
last two questions. Before we go, what are you up to these days? Is there any way listeners could learn more about your work, connect with you, or support anything you're up to these days, Trish?
Well, I'm no longer practicing and I'm not doing research about massage or publishing in that realm. I try and keep up and read it and watch at it. And because my son, Bryn Sumpton, is at the College of Massage Therapists, and of course, all my colleagues send me things immediately that they come out, and that's very interesting for me. But what I'm doing personally is after writing for peer review and so on, where I remember writing one paper and I got 90 peer review comments back. And I thought, oh, I can't do this anymore because you have to address every one of those things. And it's very specific. I have taken up creative writing. So that's what I'm doing. I mean, I look after my grandchildren who are 6 and 8 before and after school every day, and look after some elders in my family who, have varying aging complexities, and um, I try and look after my own health. But I am writing, and I'm writing creative nonfiction, which is, so people often think of memoir, for example, as creative nonfiction. So I do write that, but I also write about the things that interest me. Joan Didion, the great writer, said, I write to understand what I think. And that's what I do. I sit down, I have two women's writing groups, and I'm about to do a podcast with a woman named Shannon Linton, who has a great Substack. Um, and it's on the convergence of mothering and creativity. And I'm giving some considerable thought to that because I have been a mother for a very long time and now a grandmother. Um, and I feel that there are aspects of that which was the best of what I brought to the massage therapy world in terms of my clinical practice. I think I was very nurturing and as well as being very analytic. Um, and so spending time writing is great. And I will probably at some point set up some kind of Substack for this. I haven't yet. I've resisted it because some of it's quite personal and some of it, is about my grandchildren or whatever, and they can't consent. They're kids. Um, so I'm giving some thought, but these stories, I have about 200 stories now, and they are all being recorded. My son is recording them. He's got an audio studio set up in this house. For he records them for me. He does the intros and extras, and I'm going to absolutely have him watch you because you are so gracious as an interviewer. Um, he is as well, and we're going to record them all for posterity, and posterity being my family. Whether they ever see light of day publicly, hard to say. Hard to say. Maybe. I'm asked to speak at various things and read stories, in my community, and I do that, stories that are relevant about the things that we are all watching with extreme concern, whether it's climate change or whatever we're engaged in, and uh, because we want our children to grow up in a better world than we've given them so far. And we'd like our massage therapists to grow up in a better world too.
Yeah. Amen. Those
Yeah,
come after us for sure. Always an eye on them and appreciate
always.
we stand on.
Yeah. With an eye on looking back, which
Exactly.
is what you're doing. That's a gift. That's a gift to the profession. And thank you.
Yeah, of course. Thank you, Trish. Final thing, is there anything we didn't cover in our time together that you would like to add? The mic is all yours for as long as you'd like. And I mean that sincerely.
Oh, that's very kind. And no, I was just very honored to be asked. And this has been a lovely, lovely interview. Thank you. And I think I've said all the things I want to say. And for now, I will keep saying things, that's for sure. Um, and I hope people really gather around this. This is an important, what you're doing is very important. And I hope people understand that this is an unbelievable gift to have somebody try and focus in on this and make it happen. And I'm grateful to be a part of it. Thank you.
Thank you, Trish. I'm leaving this conversation. I know there's so much more that I could spend all day talking to you, I'm sure. I found this to be so delightful, and I'm feeling my energy and my spirits are up after having this conversation with you, Trish, and I cannot thank you enough for that.
Oh, my great pleasure. And you and I, our paths are clearly going to continue to cross. I know that will be true.
I
Yeah.
absolutely
Yeah, and I hope there is a time that we're actually face to face. Wouldn't that be lovely?
that would absolutely.
Yeah.
Let's speak it into existence and conjure it.
Yeah, let's put it out there and let's make it happen. Okay. All right.
If you enjoyed this podcast, please consider donating to the Society of Massage Archives so we can continue to bring you this episode and other resources to fulfill our mission of preserving and integrating the historical knowledge of massage therapy's professional advocacy and traditional techniques to guide and enrich our contemporary practices. Thank you. You have been listening to the Hands of History podcast, a production of the Society of Massage Archives. You can learn more about the Society at societyofmassagearchives.org. We are also on Facebook and Instagram. Do you know someone whose hands have helped shape the practice of massage? If you or someone you know would make a great guest for future episodes of this podcast, please email the Society at societyofmassagearchives@gmail.com. Society of Massage Archives, all one word, @gmail.com.